Hello guys, so I want to talk to you about something that you may find extremely interesting. Now, what you see here are a bunch of symptom checkers. What a symptom checker is. First, let's talk about why I'm making this video. Most of us hate the idea of going to the doctor because are afraid of what they'll be told. Others just hate vaccines, and others just hate shots. Others again just hate visiting hospitals. However, in some point of our lives, we have to turn to a professional. But it is always good to know our current conditions, even without going to waste hours and days and doctors in useless and costly tests, just so we can understand that we are okay. Because, well, sometimes something that may seem like a weird symptom can actually get to be something as less dangerous as you can imagine. However, among all, sorry, I was downloading. Anyways, among all, you need to remember one thing. Even though you may use any of these medical symptom checkers, it's always good to know that if you hear or see in these websites something that may be controversial, it's quite best if you actually consult a doctor, and do not, under any circumstances, that's an official disclaimer, do not attempt any self-cures on you or on your child or on your loved ones or in any other way. Now, second most important thing, because I know some parents they tend to want to help their child avoiding going to a hospital, and they give their child medicines that were designed and are the quantities of chemicals inside the pills or syrups and medicines are thought to be used by an adult. Now, when you do that to a kid, you can irreversibly do heavy damage, or it can be reversible, but with the idea that you may be doing good, you may injure your own child, your next of kin, and think in any way you want. Just don't. Consult a doctor. You can first turn yourself to consult with the symptom checkers. However, I strongly advise, do not act as a doctor or a medical personnel unless you're a certified one and unless you're quite sure of what you're doing. That being said, and that being disclosed, we're gonna start with I would like to start with the simple ones. They may be helpful for some or unhelpful for the others, but I'll bring to your attention both alternatives. So, of all our alternatives. Sorry. So, you have this www.mayoclinic.org Symptom Checker slash, yeah, I think it's slash. Well, anyways, you can see the website. Besides, I'll leave a link in the bottom below. So, without further ado, you get to check. Here you see adult symptoms or child symptoms. What you can do, supposedly your child has a minor cough. You go to a cough. Then you get options like find possible causes of cough based on specific factors, check one or more factors on this page to apply it to your symptom or your child's symptom. However, I repeat, stay aware of what you're doing and do not take risks of any sort, especially when it comes to a child. Now, if someone is moron enough to implicate damage on himself, that's fine by me. I mean, it's your life, but I still strongly disadvise that. Not to speak that doing that to your child may cause, in certain cases, even death. So, yeah, please be careful what you do, okay? Now, the fact that I'm making this video is only so I can tell you that there's a way to check things, not that you can act as a doctor, and that does not make you a doctor. Period. So, cough is dry. We are checking cough. Cough is dry, producing phlegm or sputum. So let's say that our child's cough is dry. Since we're checking a child, then is it new or recently appeared? Is it ongoing on recurrent, meaning it's for quite a while, or it's worsening and progressing, meaning that it's worsening by the day and it's, well, from dating a little bit back, like a week maybe. Anyway, you check, let's say it's worsening and progressing, and it's ongoing because it is for, like, let's say a week old, but it's worsening and progressing every day. Triggered or worsened by allergens or irritants. If it's triggered or worsened in any way by some allergens, irritants, and well, let's say that no, it just happened like that. Maybe just be the common cold, or maybe something much worse. Just keep in mind that some viruses may present that themselves as the common cold. That doesn't mean that it's a common cold. So again, be aware. Is it accompanied by chest pain and tightness, chills or sweating, diarrhea, etc., etc., etc.? No, let's just say it's accompanied by a fever, sore throat, sneezing, yeah, let's say chest pain and nausea. So at this point, you can search for possible causes, and you can see here possible causes can be pneumonia, bronchitis, influenza, flu, common cold, GERD, hay fever, acute and sinusitis, I don't know how to pronounce that, sinusitis, asthma, chronic sinusitis, yeah, emphysema, bronchiolitis, yeah, and laryngitis. Now, I'm not quite sure how you're aware of what all of these are, but in case you want, you can always Google each and every one of those. Now, the best way I use to search for things of any sort is use our good old friend Google. So let's ask Google the most stupidest of questions. Even an idiot knows that, but let's suppose you want to know what an asthma is. What? On control paste because I already copied it. Is, could go without the question mark too, but I just, you know, what is asthma, what causes asthma? Then you go and you check what asthma is. Is asthma incurable, and so on and so on. You can find information about what to avoid to to not have or your child not to have an asthma attacks, or to decrease the number of them, because what you must know, certain diseases or conditions can be fatal, and I certainly don't wish that to the worst of my enemies, because it's not we who have to judge who dies and how dies. And so, well, that's what counts to me. So we're moving on. The other symptom checker is HZ Sign Symptom Checker powered by WebMD. You can find it by entering the website www.medicinenet.com, symptoms and signs. Here is the website above. I'll leave it in the description as well, like all the others. And let's see what you want to do. For who you will be doing this, someone else. Let's say it's someone else. Let's say it's a male, and you can choose the age span. Now let's say that we're gonna check that for a 7 to 12-year-old child. Zip code is optional, so I'll leave it off, because in Italy there are no zip codes. It's a cap code, which is kind of a zip code, but I'm not sure if that's gonna work out. Certain countries have different ways of identification of cities, so we just leave it empty and submit. Now what you see here is the human. If you chose a female, it will obviously show you a female figure. Now you can check, let's say we're gonna check legs. Let's say it has the child has pain in the upper muscles in the thigh, and you check, then you get the possibilities: a broken bone, single fracture, broken bones, multiple fractures, bleeding, bruising and disoculation, drainage or pus, for the love of God, lump or bulge, multiple bruises or of different ages, muscle cramps and spasms, painful, numbness, tingling, pain and discomfort. Let's say pain and discomfort. You know, let's go with something less scary. Dull or itchy, burning and stinging, crampy. Well, crampy. Let's say it's crampy. How severe is your pain or discomfort? Well, mild. Let's say it's mild. It's a little bit, not a lot. On which side of your body is your pain, discomfort? Let's say it's one side only. Pain or discomfort brought on or made worse by rest or inactivity. Yeah, let's say it's this, because some people tend to think that if they fix themselves 24/7 in front of the TV or the computer, they're doing good to themselves. Now, no. You realize that your muscles can deteriorate and may do serious damage. And take my word for that, I had similar problem. And yeah, it's not nice. Trust me. You can get pains that you can't even explain yourself, and you start going to doctors, and yeah. However, moving forward, pain or discomfort, better with rest, better with ice, anti-inflammatory medication. Let's say it's better with anti-inflammatory medication. Pain or discomfort is associated with prolonged plane ride, prolonged bed rest, recent surgery, recent injury or trauma. Let's say it's prolonged bed rest. Is it sudden or gradual? Let's say it's sudden. All of a sudden you just feel like a ow, like a pinch. And then you get to see, it could be the most popular possibility goes to muscle strain, tendinitis, and the other are least possible, but it could be each of those. However, you can see here this little blue line And the bigger it is, it means the most probable it is that it's this problem. Now, muscle strain, what it is, you click on it and you can read the overview, muscle strain overview, what to expect, how common it is, treatments, self-care, made worse by, when to see your doctor, again to the point where we started off, see a doctor if it's something that requires attention. Questions to ask your doctor. Now, what this advises you is what you should talk to your doctor about, because I've noticed that many people have no idea what they're doing there. They go to the doctor and they're like, well, doc, you see, I have this pain, it's kind of painful. Duh, it's painful, of course. It's a pain. And duh, you're the doctor, but trust me when I say your doctor is not a magician and he is not a medium, so you need to be more specific what you want and what you want to explain. Now, being frank, being open with your doctor can open quite a bit the span of what your doctor can do, or can limit his possibilities and leave you unsatisfied. But that doesn't mean your doctor is a moron. That could probably mean that you are the moron, which I hope is not the case. Still, even for a complete moron going through that website or any similar one can review and inform himself about how to proceed, and so on. However, now I'll go back and see. Let's see, tendinitis is a second possibility. You can do it with going back, etc., etc. And you can see tendinitis overview, the same thing. What questions about your doctor? Maybe was by blah 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 blah. Diagnosed by. It tells you how it can be diagnosed and what your doctor may prescribe, like an X-ray if needed, or rule of fractures or other problems, and so on. That being said, we're moving on. You see, is quite the same. That's because it is, but for what it seems, both websites have some connections. However, you can choose either symptoms.webmd.com or .medicinenet.com, which is practically the same. And the fourth, and my favorite of all, it's practically the best way to get informed, is this. This is www.everydayhealth.com/Symptom Checker. Now, here's the website. I'll leave it in the link. That's my top one. Well, how this works. First thing, let's hear a word from the doctor that participates all over this website.
In order to evaluate you like your doctor, I'm going to ask you questions.
Now, obviously, you heard Mr. Schueler, Dr. Schueler, Dr. Steven Schueler, MD. He told you that he practically would like as much as information he can get from you. Now, this is not some video connection to a doctor that sits 24/7 in front of his PC waiting for some moron to connect and ask him dumb questions. Those are audio video recordings, obviously with lower quality and small size, so they can be loaded almost instantly, which makes it even better. And he'll be guiding you through an entire process. Now, I will stop talking for a little so I can leave Dr. Schueler to do his work. Now let's just assume initially that we're having abdominal pain, and let's see what he will do for us. I'll just amp the audio a bit. Yeah. So, what's your age? Female? You can see those. So, moving on.
Do you have severe abdominal pain?
Severe? Yeah, sure. Why not?
Have you had severe abdominal pain?
Nope. Now, at this point, I wanna interrupt for a second so I can give you a little hint. Some people are not fluent English speakers like me. Well, not fluent. I mean, I'm not perfect, but hey, I come from a Cyrillic country. Our alphabet is Cyrillic. Our way of talk is Cyrillic, and I do know English very, very good, but I make certain errors sometimes. So, well, sometimes you can get confused, and so basically you can tell me more. Tell me more will tell you another audio.
To describe the person from experiencing moderate to severe pain. On a scale from 1 to 10, moderate to severe pain would be a 6 or a 7.
Then just again, this Dr. Stephen Schueler just explained to you what counts as a moderate to severe pain. On the scale of 1 to 10, he said that would be like 6 or 7. So, do we have one? Let's say no. Not worsening. Nope. Now, some people may say, what the fuck is hernia? Because most people know what a hernia is, but some don't. So again, you always have this option, tell me more, where another video will appear and tell you, well, that is this info right there. It represents blah blah blah. We will not go into that kind of detail, but just for the record, you can always check on tell me more. Let's say it's no, we don't have a hernia. Now some people may say, especially not fluent English speaker, may say, what the fuck is sorry, what the hell is a bulge or a knot in the groin? What bulge? What? Well, here you don't have a tell me more. Now, how do you know what a bulge is? Well, just mark the word, copy it, or if you're using Chrome, you can just right button, search for bulge, a rounded swelling which distorts an otherwise flat surface, which is like a pimple of some sort. You can try to see images about it. Swell or protrude. So basically, you can get the idea what it is. Then you cannot search for a knot, because knot is, well, it can be done by a rope, but it can I mean, that's the problem with some languages. Some words are with different meanings, and someone that is not a fluent speaker can get easily confused. And there's the growing here. If you click, you will get this balloon. It will say the body region surrounding the junction between the trunk and the thigh. The genitals are usually included as part of the groin, which means a little bit around the male phallus. And have you developed a bulge? No, no bulge. No. Let's say yes. And let's say it's a 37 Celsius, which would be around the normal scale. Next, you have diabetes. No diabetes, dude. No. Are you? I'm really sure most of you know what that means. It means, have you pissing more than usual, more frequently than usual? Well, let's just say yeah, because normally when you get cold it's like this. A little bit. No. 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 Stool. That's like your saliva when you cough and like it falls out, and then is it colored and becoming black? No. Now, I want to just put it for the record. I don't have any of these symptoms. I'm just impersonating an idea of a person having those. So we're just playing guesses here. So moving on, let's say that the person has no stool, no bloody stool, sorry, and no stool, he'll be dead. Oh hell. No. No. Now, some of these hints may tell you that in some point of your life, if you see some symptoms like those, you'd best be to pay attention to what your body is telling you and try to find out what the hell it is. First thing you need to remember is try to know your body. That good. Try to know your body that good, like most people know their cars good. Now, a good driver can recognize a problem with his car only by hearing how it sounds and how it vibrates. That is something you need to do for your body. You need to know where your body is functioning right and when it's not. And you need to be able to see even the smallest detail. So try to pay attention to your body while it's in its full health as more as you can, so you can find the differences when it's not. And that way probably avoid complications. So, oh hell no. Yeah, sure. Certainly, just a little bit ago, he asked me a question: Do I urinate frequently? Since we already answered for hypothetically that I urinate frequently, and sometimes you can get some idiotic questions, but please answer all of them if you want to get to the bottom of what's happening with you. So, moving on. Yeah, let's say yes. No. and we got the results. And then we got to the finish line. What might be wrong with you? Your symptoms could be caused by several conditions. Below I have listed the conditions that concern me the most. Seriously, urinary tract infection. You can see a video about it. Acute pyelonephritis. What the fuck? Pyelonephritis. Yeah. You can check on that word and words that have no idea what they mean. So when should you see a doctor? Because your symptoms could worsen, I recommend that you see a doctor now. When you see the doctor, he or she will check you for those conditions and make a diagnosis. And then you can see where should you go for care, special instructions, what tests may be done during doctor's visit, blood tests, ultravenous line, urine tests, etc., etc. Find a healthcare provider in your area within 5 miles, within 100 miles, 50 miles, 20 miles, etc. Related articles can in some way... so pyelonephritis means some sort of kidney infection. That hypothetical disease we just created turns out to have some connection to a kidney infection. Oh fuck. That just even to a healthy person, that can bring out the goosebumps. Holy hell. And manage your health online. Sorry, may I disadvise to that? I mean, it's always better to see a professional and, not take any chances and risks, especially if you're going to treat something like that, or, kidney infections. I mean, there are diseases you don't even want to mention, much less having them. So, supposedly, you want to know serious urinary tract infection, click the video, and it will pop right here. Thanks, dude. That may be a 6-second video, but it explains in very short and quite sufficient what he means. Acute pyelonephritis, blah blah blah. What the fuck? I can't even pronounce that word. Anyways, let's see the video and. Thanks, dude, you just spelled it for me. Pyelonephritis. It's a kidney infection, alright? So, anyways, now that you know how these websites work, I hope for your sake you keep getting the good news and you can avoid going to doctors when there's something minor. And again, please be advised, avoid self-cures unless you know what you're doing, and do not, under any circumstances, do not treat your child like an adult. In fact, do not treat your child at all. Consult a pediatrician, because your child's health may worsen, not because you are incompetent, but because you may do an error that may be hardly reversible or may cause damages. So please be careful and don't act as a hero. You'll turn out to be the villain in the end if you try to do on your own head. Try to consult a specialist. So that's for this video for now, guys. I was DolcePanna, and don't forget to subscribe. I'll be making a whole lot of useful video for the future, and peace. Be sure to subscribe for my YouTube channels. Add me on Google+. Twitter, Instagram, and add my Facebook page as your favorites.